Hello and welcome to the Prostate Zone. I'm Alan and this is Colin.
Hi Alan.
Today we're going to be talking about penile prosthesis. Is that correct, Colin?
Prosthetics or implants.
Implants, correct. And for those out there who aren't too familiar with this particular terminology, it relates to implanting an artificial device into a man's penis who are having erection difficulties, particularly after losing their prostate mate. So let's ask for Colin how the whole thing got to this point. So Colin, what's your background dealing with prostate cancer in particular?
Well, like most blokes over 50, I guess I was having my annual PSA test, which was gradually increasing over the years, until my GP said, let's have a biopsy, which I did. Mm-hmm. Clear, beautiful, off we go again. But 2 years later he said, well, it's time again, so we did it again. And this time it came up with a cancer. Not nice one. Gleason was 7. I said to a mate, 7? He said, oh, it's all right. I said, yeah, but it only goes to 8. He said, oh, okay. So we decided what to do next. The choices were surgery, chemotherapy, alternative medicine, do nothing. So I spoke to all of those relevant surgeons and radiologists and everyone and decided that surgery was the best, so we removed the prostate. And after that, the joys really began because nothing worked. I had erectile dysfunction, incontinence, and all sorts of problems. But gradually the incontinence pretty much went away, and now we're still stuck with the erectile dysfunction. Mm-hmm. Tried Viagra, Cialis, tried the daily dose, 5 milligrams, and a 20 milligram boost on a Saturday to see if we could get some action. Nothing. So back to this doctor again. What about injections, penile injections? That'd be fun, I thought, putting a needle in it. But anyway, needs must, and we decided we would go for the penile injections. The first one under supervision with the surgeon and the nurse, with mild success, maybe 70%. So we then tried upping the dose, and we got the problem then, we went for too long, 4 hours, and I didn't need an erection that lasted 4 hours.
No. And
it was extremely tender, so they decided to change the recipe of the injection. Again, hit and miss. Occasionally it would work, but usually it wouldn't. Sometimes I'd get a 50%, sometimes nothing. So I said, this isn't working. What other options are there? And that's when we started looking at penile implants.
So when you say that the injections did or didn't work, were there 2 different types of injections they discussed? Like there is the curvature one that some men are prescribed, or there's the Trimix, which is different again because you can draw up a different amount of fluid. Because some men, we're talking about injections because the other medications weren't working. What about the vacuum pump? Was that ever discussed with you as well?
Did use the vacuum pump. I used that in conjunction with the tablets. Again, it wasn't very successful, and I used to need to have a constriction ring. And yeah, that gives you that hinge effect where it's nice and hard here, but nothing supporting it. So that wasn't overly effective. Yes, you could use it for masturbation or for penetration, but it was not ideal.
Yes, I've heard an expression that having that sort of an erection when you've used the vacuum pump and a ring, or as it's sometimes called a cock ring, it's like playing snooker with a piece of rope. You've got it nice and straight, and then you go to use it and it wobbles all over the place. Now, what about go on, sorry.
And unless the constriction ring is really almost painfully tight, there is some leakage and you lose pressure after a short time.
And then the Trimix, were you experimenting with different amounts of the fluid?
I tried different amounts. I tried the L-Prostadil first, which is the first one they prescribe. And then afterwards, when you complain about the pain, they say, oh, well, yeah, that's common in about 50% of people.
Yep.
So now we'll try the Trimix. And different doses, start off with a very minor dose and increase it until you get a satisfactory result.
And just as some background for the viewers, your operation was done through the public health system, that's correct?
It was, yes.
So did they mention to you that the next course was the penile prosthesis, or did you bring it up with them? How did that function?
Because I kept complaining, this is not working, that's not working, and they said, well, the only other option now is a prosthetic, an implant, and that was sort of where we worked on it from there.
Okay. And obviously that didn't happen overnight. You would have been on a waiting list, and I think we're talking now because of COVID. Did COVID impact on that approach as well?
Actually, COVID worked in my favour because when they diagnosed the cancer, because it was a class 1, it put me near the top of the list. And because all the hospitals were pretty much shut down and partly empty, a lot of surgeons standing around twiddling their thumbs, I got in very quickly and had the prostatectomy. So the same result applied when I came up for the implant surgery. Things were still quiet, and it was able to fit that in quite well. But the prostate, the waiting list is about 2 to 3 years for this sort of surgery because it's not deemed essential or life-threatening or saving or anything.
No.
So it's just, you just keep pushing back, or someone's more urgent and gets slided in front.
So because it's the public health system, I think viewers need to be aware that if they, an individual man had private health, he would probably be able to get done in 2 weeks. Is that what I'm hearing?
Much quicker, yes. The public or the private health insurance companies cover quite a bit of the expense. The cost of the surgery, if you do it privately yourself, pay for it, is about $26,000.
Yeah, so
if you have private health insurance, the out of pockets is about $5,000 to $6,000, and the public health, of course, is under the public health.
So you've been able to make a decision with your surgeon that you're finally going to get this implant. Was there a lead-up time? What did you need to do before that happened?
Once the decision was made, it was just finding a slot in the hospital, and that was the most time-consuming bit. They book you in first for an artificial erection test, which can be done under general anaesthetic, and I said, no, I've had erections before, they're not that bad, can we just do it with a local? And they said, yeah, sure, we can do that, which I was pleased I did, because the surgeon, while he's doing that, is able to say, now I'm just going to do this and I'm doing that, and I'm telling me what he's doing as he's doing it. And basically they numb the area, they pump it up, inflate it as hard as they can, have a good look at it, and decide if there's anything else that needs doing. And in my case, I had what they call a waist. My penis looked a bit like an hourglass, so they decided to fix that at the same time. Quite amusing, like being awake, because the nurse is running around taking photos of it. Photo here, photo. Oh, goodness me. And she leans across the top of me, excuse me. Yeah, it was a bit of fun, but yeah, we do that, then go back to the booking nurse and book a date for the full surgery.
You mentioned having a waist so within your penis. Were there any other issues around that? Because you said you had been injecting for a while, and for some men who inject into their penis, they can get some scarring, which creates a bit of a curve. Was that an issue for you as well?
I had some Peyronie's disease prior to that anyway, which had been developing over the last few years. So I asked him about that with the surgery. Do they fix that? And he said the implant itself will take care of that. That will straighten it out, and you'll get rid of that Peyronie's over.
Okay, superb.
So once the implant was in, the Peyronie's had gone.
It's interesting you should say that, because from my understanding, these implants are fairly common because a lot of men, not even having to have prostate cancer, have Peyronie's disease, which is a real curvature, and they're finding, as you've got experience, having that implant gets rid of that curve and they're straight up and down straight again. So fast forward, you've been booked into the hospital. How long were you in hospital, and how long approximately was the operation for?
There's a bit of procedure, preparatory stuff again. There's 3 days on a strong antibiotic, and the pink solution they use in hospitals for sterilising, you have to shower in that for 3 days beforehand. Hair, inside your nose, inside your ears, everything has to be sterilised. And you do that for 3 days. They booked me into the hospital the night before, so as they could make sure I was still clean and sterile and all of those things were right for the next day for the surgery. Go and get up in the morning, shower with all this pink gunk, and off to the surgery. So again, after the surgery was another 3 days of very strong antibiotic, because the surgery itself is quite safe, and the biggest threat or problem with it can be from infection. So they're really, really concerned about making sure everything is sterile and there's no risk of infection.
Oh, okay.
Because then the whole thing has to come out again, and you waste months while it heals again before you can do it again, and you lose size and all sorts of problems if that happens.
Now, for those who are wondering, you've got this implant, you've got the rods, plastic rods inside your penis. Do they pump up at any stage while you're in hospital? What happens before you leave?
The surgery. He said, after the surgery, he said, "Oh, you'll notice you've got a partial erection." I said, "Yeah, it's about 70%. He said, "Well, you're going to have that for the next 3 weeks." What? Now, when I was 21, having a 24-hour erection sounded, yeah. But now it's not so much fun. And, you know, going to shopping in Safeway is not proper etiquette, walking around with a 3/4 erection. So it was a bit embarrassing for that couple of weeks. And because you're not used to it being there, sticking out all the time. It's usually just tucked between your legs.
Yeah.
And so every now and then you knock it on something, particularly shower screen doors and things like that. And it's very painful. So, yeah, that was a bit of a thing. The reason they did that, because they put a graft in as well, and this was to make it heal in place. Otherwise it would heal shrunken down. Then when I started using it, I'd have to tear away that healing to make it back to where it should be. So they left it at that 3/4 mast for the first 2 to 3 weeks.
And I guess for viewers, what's it like waking up in the morning? Because most men, before they have an issue around prostate cancer and losing their erections if they've lost their prostate, what's it like now what was it like waking up at that point with Percy, your penis, looking at you basically?
Well, under the surgery it wasn't that exciting because everything was too tender to touch. But now it's nice. I can be lying in bed and just a few little pumps and up she comes, and it's nice to wake up with a morning wood, don't you? Everyone enjoys that.
It is, and I think what maybe the population, but most men understand it, all of a sudden that's gone. Once you lose your prostate, mate, your erections go, in most cases, of course, everyone's different, we need to clarify that. But to wake up without that all of a sudden is a weird sensation. But to get it back, I don't know how you were, but it was
3
like,
years without a natural erection was, yeah.
and when you get one, you go, my God, this feels good again. It's a weird one.
A bit
So,
of excitement and fun in the hospital, by the way, little anecdote, because you leave all your inhibitions and things at home when all this goes on, because half the medical profession in Australia has now had a look at my penis. And after the surgery, because they wrap it all up like a mummy's, and they leave just the tip of the head of the penis out. And every half hour, the nurse comes in and takes blood pressure, pulse, blah, 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 and said, "Oh, I'll just have a look," and pushes down on the end of it. Oh, good. And so this happens every half hour for the first 6 hours, and then every hour after that. And I thought, oh, goodness me.
you've had more women look at you.
Glad I left those inhibitions at home.
Yes. So you've you spent 3 days in hospital and you walk around with half a stiffy for about how many weeks before that could be changed?
2.5 weeks, yeah. And then they go in, test it all out. Again, the surgeon and the nurse check it all over, make sure it's all there, show me how to pump it up, how to release it, let it down again. Again, room full of people. Yeah, so.
And were you given instructions once it had healed and you were able to pump it up and down? Did they say you need to do this every day for X number of times, months?
Yeah, for 3 months you have to pump it up for at least 10 minutes a day.
10 minutes a day.
Just
So
to get it stretched into place, the healing's in place, anything that's healing back in the wrong position stretches it out again.
okay.
So.
And just as an aside, which as you were talking about the operation, having to prepare yourself, did you have to, shave yourself all down below? I'm assuming that would have happened, wouldn't it? Just to get the.
They didn't ask me to, and they didn't do it while I was awake in the hospital, but I think they did while I was under.
Okay.
They gave it a quick shave.
So fast forward, you've been pumping it up 10 minutes every day. Was it in the morning, or was it just at some time of the day?
Usually in the morning.
In the morning.
Yeah,
Yep.
there was no special regimen.
Okay. Now, I think most viewers would like to know, does this really work? I mean, what's the response?
Yes, it works.
It works.
And no, I would not go back to not having it.
Okay.
Yeah, I wouldn't take it out and swap what I had the last 3 years.
And with a partner or, well, in this particular case, we're talking about a female anyway, at least. Any responses? What, do you know what sort of, how they feel about that?
The last few years have been a bit, nothing's worked and nothing happened, and my emotional state was pretty RS, to put it bluntly. And there hasn't been a partner for quite some time, so it's been a bit of an effort to get back into that routine of dating and seeing ladies again. In the meantime, I have visited what colloquially termed the rub and tug shops.
Okay.
And unless I point it out or make a comment on it, nobody notices or cares.
Okay.
So I just discreetly pump it up while we're there, and they do the rest.
And it's a la naturel as far as they're concerned.
Yeah.
It just looks like another.
There is a bit of a nasty looking scar underneath, which when he's up you'll see it underneath, but when he's down you don't notice it.
So you're really happy with what's happened so far?
Very happy.
Yep. And I think the viewers just need to be aware that we're talking about a procedure that's been done in Australia, so the public health system here in Australia is going to be different to elsewhere, overseas, New Zealand, the US, etc. But at least the public health system within Australia, even though there are different states, would have a similar approach, we could assume by that?
I would assume so. It's Australia-wide. The procedure's done Australia-wide. The clinical surgery I went through, I think they do, he did tell me, 80 to 100 a year.
That's a lot.
Each, and there's 2 of them.
Yep.
So yeah, there's quite a lot done. I found out after I'd had the surgery. I know some people that have had it done and just quietly had it done.
Yep.
I said to a mate, I'm going in for it next month, and he said, "Oh, I had that 4 years ago." What? Why didn't you tell me?
Another one of those secret men's businesses. It's not secret. It's like you talk to 4 or 5 blokes and you go, "I've lost my prostate, mate," and they go, "Oh yeah, we lost ours as well." Like, well, how come you haven't spoken? It's that
Aussie men, we don't talk about our bits.
No, we don't, and it's and having this, I think it's important that we have this little conversation, and it's put out there to say, look, if you are having difficulties getting the erection, whether you've lost your prostate or for what other medical reason, there are options, and you need to explore them. But obviously, not via Dr. Google. Go and see your GP, get a referral to a specialist, and find out what your options are. And as you said, you're really happy with it.
Yeah. So it works. I'm happy. Luckily, I got it on the public health. If you're planning on doing it and you can get private insurance and wait your 2 years to qualify for the surgery again. So it's about the same amount of time, unless you will have private health insurance already. If you go the public health way, I'd recommend the squeaky wheel approach. Keep at them. How's my list? Am I coming up on the list? When am I due? Just ring them every month or 2 and just remind them you're still alive and still wanting it done.
Fantastic. Well, I hope this has been of some enlightenment to those who are watching, to hear what it's like for one man at least who has had an implant, but it sounds like there's a lot of blokes walking around there with an implant. And if it's something you were thinking about, then go and talk to your GP, talk to your specialist, find out what you can do next. Thanks for watching, and thanks, Colin.
Thanks, Alan.